Hypertension or high blood pressure is a common health concern that can also occur during pregnancy. When blood pressure rises to unhealthy levels during pregnancy, it can lead to complications for both the mother and the developing baby. Two serious conditions associated with hypertension in pregnancy are preeclampsia and eclampsia. These conditions require careful monitoring and medical management to ensure the well-being of both mother and child. Pregnancy naturally brings about changes in a woman's body, including changes in blood pressure. For some women, these changes can lead to elevated blood pressure, potentially impacting the pregnancy. It is important for expectant mothers to be aware of the signs and symptoms of hypertension during pregnancy, and to seek prompt medical attention if any concerns arise. Regular prenatal care is essential for identifying and managing any potential complications. Understanding the different types of hypertension that can occur during pregnancy is crucial for proper diagnosis and treatment. Chronic hypertension refers to high blood pressure that was present before pregnancy or develops before 20 weeks of gestation. Gestational hypertension, on the other hand, develops after 20 weeks of pregnancy and typically resolves after delivery. Preeclampsia, a more serious condition, involves high blood pressure along with other symptoms such as protein in the urine. Preeclampsia is a serious condition that typically develops after 20 weeks of pregnancy in women with normal blood pressure. It is characterized by high blood pressure and protein in the urine, often accompanied by other symptoms like swelling, headaches, and vision changes. Eclampsia is a rare but life-threatening complication of preeclampsia characterized by seizures or coma. Preeclampsia can affect various organ systems in the body, including the liver, kidneys, and brain. The exact cause of preeclampsia is not fully understood, but it is thought to be related to abnormal development and function of the placenta. Risk factors for preeclampsia include first pregnancy, advanced maternal age, multiple pregnancy, history of preeclampsia, and certain medical conditions like diabetes and chronic hypertension. Hypertensive disorders during pregnancy can lead to a range of complications for both mother and baby. For the mother, these complications may include damage to organs like the kidneys or liver, HELLP syndrome, which is a severe form of preeclampsia, placental abruption, stroke, and in rare cases, even death. For the baby, complications may include premature birth, low birth weight, growth restriction, and respiratory problems. Early diagnosis and management are essential in minimizing the risks associated with hypertensive disorders during pregnancy. Regular prenatal checkups, blood pressure monitoring, and urine tests help healthcare providers identify and manage these conditions effectively. Treatment options may include medications to lower blood pressure and prevent seizures, along with close monitoring of both mother and baby. In some cases, early delivery may be recommended to prevent life-threatening complications. Section 4. Effects of hypertension on the mother's health. Hypertension during pregnancy can have significant effects on the mother's health, both in the short and long term. In the short term, high blood pressure can damage the blood vessels and organs, increasing the risk of complications like stroke, seizures, and organ failure. The kidneys are particularly vulnerable, and preeclampsia can lead to kidney damage or even failure. Long-term effects of hypertension during pregnancy can include an increased risk of developing chronic health conditions such as cardiovascular disease, chronic kidney disease, and stroke later in life. It is crucial for women who experience hypertensive disorders during pregnancy to receive ongoing monitoring and manage their blood pressure effectively to minimize these risks. Maintaining a healthy lifestyle through diet, exercise, and stress management is vital for overall health and well-being. Section 5. Effects of hypertension on the baby's health. Hypertension during pregnancy can also have significant impacts on the baby's health and development. Preeclampsia and eclampsia are severe forms of hypertension that can affect both the mother and the fetus. High blood pressure can restrict blood flow to the placenta, depriving the baby of essential nutrients and oxygen. Preeclampsia can cause severe headaches, vision changes, and swelling in the mother. This can lead to slow growth, low birth weight, and preterm birth. Eclampsia, which involves seizures, can be life-threatening for both the mother and the baby. Premature babies are at increased risk for a range of health problems, including breathing difficulties, feeding problems, developmental delays, and long-term disabilities. Babies born to mothers with hypertensive disorders may also experience low blood sugar levels, difficulty maintaining body temperature, and an increased risk of jaundice.